Hello, my name is Rona Corral, and I'm the nurse manager of the Carroll Ball Medicine Unit, a 38-bed unit that opened in 2010, admitting lower acuity medicine observation patients. However, in 2015, the Carroll Ball Medicine Unit transitioned to a general medicine floor with higher acuity diagnoses, including challenging patients with behavioral, social, and psychiatric issues. There has been an increase in the number of incidents related to verbal and physical abuse to staff from patients and family members. Staff have verbalized concerns on how they can effectively and safely manage aggressive and disruptive patients and family members. From the recent debriefings related to a crisis situation on the unit, the need for a structured approach was identified. The use of team step strategies was introduced to the team to effectively manage a crisis situation. These include effective leadership, communication, mutual support, and situation monitoring.
Hi, Miss Marshall. I'm Lorna, the charge nurse. How are you?
I'm fine. I need a cigarette.
Wow.
I want to go smoke or else I'm going to leave.
Miss Marshall, I'm sorry. It must be difficult for you not to smoke. Unfortunately, it is the hospital policy that smoking is discouraged for safety reasons. We really want you to stay because we want you to get better. We hope you make the best decision for your health, and we're here to support you. We can offer you nicotine patch or gum to help with your cravings.
I am ready to leave.
I will notify the provider to order them for you. Is that okay?
I would say one of the most important things is to work on self-regulation, staying calm, cool, and collected, doing our best to manage our own tone of voice, and not taking things personally, and just kind of empathizing with a person's situation.
Good morning, Ms. Marshall. I heard you had some concerns about your food.
Yes, I'm very hungry. I've been waiting for this test all morning.
For example, if I have a patient that has been sitting still for a period of time waiting for a CAT scan or an MRI and they haven't had food or water, oftentimes what I'll say is, I'm really sorry, that is a really terrible situation. We all feel really upset when we don't get to eat or drink. And if there's anything I can do, maybe I can talk to your care team members and kind of problem solve the situation. Look at any type of alternatives and offer solution.
I apologize for the delay. I understand you're very frustrated, but this test is very important. Please give me a few minutes and I'll find out your status of your test. Let me call them up and I'll update you with the schedule as soon as I get the confirmation, okay?
Sure, thank you.
I'll be right back, okay?
There has been an increase in the number of incidents related to verbal and physical abuse to staff from patients and family members in Carroll Ball Medicine Unit. In calendar year 2017, 6 events were reported related to physical abuse and verbal threats to employees by patients and/or family members in Hero.
Hi, Miss Marshall. I heard you wanted to talk to me about the visiting policy.
Yes, last night the nurse let my family stay, and I'd like to know why can't he stay tonight?
Miss Marshall, I apologize that our visiting policies and hours weren't discussed with you and your family last night. We were trying to protect your needs as well as the needs of your roommate, and your roommate may not feel as comfortable with them now at the bedside. I'm so sorry, okay?
When a panic button is activated, the communications officer immediately dispatches security to the area. Once the officer reaches the area, they talk to staff on what's going on and get direction from medical staff on what to do. It could be holding the patient or the use of soft restraints based on what staff needs. For physically abusive patients, we secure the patient and wait for direction from medical staff. At times, we escort patient off the unit based on the medical team's request.
Mr. John, this is Ashada. I'm your nurse. I'm here to change the battery. Mr. John?
Not right now.
Sir, we cannot wait. We have to change the battery as we monitor your heart.
Why you guys keep bothering me? I was sleeping.
Is anyone can call security?
When a visitor restriction is initiated, it can be done by either the medical staff, the patient, him or herself, or the patient's family.
Hi, Miss Smith. I heard you are in a pain and you're getting frustrated. You want to see your provider?
Yes, I am so angry. I've been waiting for hours. Hours. I don't want to get out of here now.
I'm so sorry. I apologize. I know the doctor is aware he need to see you. However, he's with another patient. As soon as he finish, he's gonna come and see you. And I understand your frustration. I know. I hope you will make a right decision to stay. And meanwhile, if you think how I can help you, can I bring some hard bag or food
Thank
bag?
you so much. Yes, I would like that.
The behavioral contract is initiated to address unacceptable behavior such as verbal and physical abuse to staff or other patients, non-adherence to smoking policy, tampering of IV access, destruction of hospital property, and any infraction of other hospital rules. This is a team's decision and will be enforced by all members of the healthcare staff to ensure that patients comply with hospital guidelines for acceptable behavior. The nurse, charge nurse, and sometimes security personnel are involved in the implementation of the behavioral contract. We discuss concerns with the patients, inform them about policy as it relates to disruptive behavior, and that if the behavior continues, he or she will no longer be able to participate in the patient-provider team and can be, as such, administratively discharged.
When responding to unhappy and potentially aggressive patients, staff should be mindful of their tone of voice, body language, and facial expression. Try to compromise and offer a solution. It's always best to inform the charge nurse or escalate the situation and to the provider as well if you are not comfortable dealing with that situation in the room. Do not argue or confront the patient. Leave the room, and you can always say, "I'm so sorry if you feel like I'm not meeting your needs. I will get the charge nurse or the provider for you." Then you have to leave the room.
Hello, my name is Renee Blanding, and I am the Executive Champion for our Team Steps project in terms of managing the aggressive and disruptive patient. And we also are using our Team Steps framework for this initiative. Team Steps is a perfect framework for this project, namely because we are deploying and employing all of the 5 principles of Team Steps, particularly leadership. We definitely have to have leaders throughout the floors, our inpatient floors, who are aware of these types of patients in all situations. The other is team structure, which is super important. We have to know our roles in critical situations, and we all have to know what our roles are when we have to react to a life or death or very, very challenging situation. The other, which is very, very key, is communication. We have strategies such as call-outs, checkbacks to make sure that we are communicating optimally in these situations. The fourth is situation monitoring, where we are aware of our patients and the situations around us at all times, which is absolutely critical to taking care of our patients. And the last is mutual support. And it's important in managing the aggressive and disruptive patient, but it's also very, very important when we are taking care of our patients and each other. And so we look forward to telling you more about this project. We're excited about going through some of the barriers. We're excited about talking about huddles, debriefs, and many of the, tenets of Team Steps. So we look forward to giving you more information, and thank you so much.